I want to extend that quality of life to our clients. You can come and get the top and longevity care. And we use a dose of 250 billion around exosomes. And you apply it. Stem cells are great. And I think they help a ton of people. I worked in ER for about 7 years.
We are the medicine.
Money to me is an energy, and it's an energy of love. You know, I had a period during this time where I was sleeping in an abandoned Foot Locker. And you have to overcome beliefs of doubt about yourself. You have to overcome all these limiting beliefs of your self-worth. And you do that.
Today, I'm meeting a doctor who is transforming the future of medicine with stem cell therapy. He helps to recover from injuries, reverse aging, and restore hair. We met at the Joe Dispenza conference. So get ready. The conversation will be deep. Dr. Charles, thank you so much for your time, and I'm super happy to see you.
Oh, I'm super happy to be here.
Let's talk about your business, your lifestyle, some interesting stories. Can't wait to hear. We are at your office. Let's tell to everyone what are you doing here.
We like to think of ourselves as a longevity partner, and the mission is to open longevity centers. So sounds very esoteric. So what does that mean? You know, it's really picking the most beneficial therapies for patients. Mm-hmm. It's the process of getting the most beneficial therapies for our clients and putting it in a way that distills it, right? So if you go on Instagram or on Google, there's 100 different things that you can use. We want to make sure just a few things that work we offer. And one of the most powerful things we found is stem cell and exosome therapy. So I've done it on myself. I was almost completely bald. So I did it on my hair. I've done it on my injuries.
When was it?
It was almost 10 years ago. I was like just turned 30. And I was with a partner at the time, and I was taking this Rogaine foam, and so I was using it, and I was staining the pillow yellow, and she was getting mad. So, you know, I'm just going to stop taking it. And as soon as I stopped taking it, all of my hair fell out. And so the next follow-up story was I got on this drug called Propecia, finasteride, just to make it better. And I didn't know this at the time; it wasn't public back then, but it gives you like sexual side effects. So like the male thing stops working.
Oh.
And I was not used to that.
Yeah.
I was young, just turned 30. So of course I got off of that right away.
Yeah.
But I was still bald. And so I went and did a stem cell hair transplant. You know, I was already in kind of the industry, learning about stem cells. I was a researcher, I'd already published at that time. And I got my hair back. And then I was still competing in jiu-jitsu, training with some MMA guys, and you know, I've torn my UCL, my LCL.
Yeah.
I even had a pec major tear where I tore my complete pec major off my humerus. So I'm a big believer in treatments that keep you back in life and doing the things that you love. And I still wanted to compete. I still wanted to train, of course, young guy. So now these injuries are, 5 to 10 years old. The hair is about 10 years old, and I'm still doing well. I still train and compete with elite athletes, although they beat me up mostly. But I'm still able to just be in the room and have some fun. And that's the biggest part to me. So I want to extend that quality of life to our clients. And so we've opened up centers from Los Angeles to New York City to here in Florida, Austin, Texas, Atlanta, as we want to really open places of healing, places where you can come and get the top and longevity care. And I think stem cells and exosomes are a huge part of it. We see a lot of it in the media now. You know, Robert Kennedy, he's talking about making stem cells, live stem cells, fully legal, which is a great push forward. And other things that cause neuroplasticity, right? We know psilocybin is great for neuroplasticity. It's great for depression, PTSD. At some point, we're even using LSD in like clinical trials back in San Francisco, and we just stopped.
Why?
There's a lot of conjecture why it stopped. You know, the most conspiracy theory one was there was the war on drugs, so to speak, because they found out for the first time ever they were trying to enlist people in the military, and areas where there was high use of psychedelics were not enrolling. And it was the first time we've seen that in history, and so we went on this war on psychedelics, war on drugs, and I think it was a bunch of propaganda personally. But they cited, of course, safety data, where, in my opinion, psilocybin, especially when chaperoned by a clinician, is one of the safest things you could possibly do. And I think more people, especially those with PTSD, veterans, major depressions, major traumas, for me, there's some clear research to show that even one macro dose or a large dose done in a specific setting can provide a benefit. So centers for alternative therapies, hopefully one day we're allowed to bring that into our centers, but we want to be a place where acceptance of Eastern philosophies with acceptance of Western high-tech medical care merged together. So when you come into a center, yes, we are clinicians, we're board-certified doctors, but the office looks like a little bit of a yoga center or a wellness center. You know,
I love it.
Yeah.
I love it.
Yeah.
Because you cannot do everything by book, right? Which they teach you in a medical university.
No.
There are another side.
There's a much bigger side that we don't learn about, right? So we learn about the food pyramid, right? It wasn't until I was already an attending physician, I was like, wait a minute, if we only ate the bottom of the pyramid, you would die. But if you inverted the pyramid and you had some fats and you had meats, you could live fine. In fact, based on the Harvard research study, I think a couple thousand people looked at, it helped with diabetes, inflammatory conditions, and it was just a carnivore diet. It's like, oh, well.
Can you be on that diet for a long time? What do you think?
I personally did it for a few months, and I had some severe eczema on my skin, probably from my gut biome, and it just was gone.
I heard many successful stories like that.
Gone.
So you think you can implement that diet just for some time, but you cannot be there for a long time. Only eat meat for 5 years.
I think you probably could do it for 5 years. I've yet to meet someone, definitely for a year. I believe in a well-balanced diet.
Me too.
So fresh fruits, fresh vegetables from the ground, organic. Most of what we eat is not real food. You turn the back and you look at what's on there. It is wild. You know.
I don't eat this type of food.
Yeah.
And you, as a doctor?
Oh, I try to stay away, although I do like my cookies, so I try to get organic
Which cookie?
cookies. Chocolate chip cookies are a weakness for me. But now I have them made with cacao and with
there is also alternative.
yeah, coconut flour maybe.
To make similar taste.
Exactly, it's exactly what it is. So that's my weakness. But when you go to restaurants, it's also particularly hard, right?
I don't believe that you go to the restaurant and you don't say to chef, don't use seeds oil. You don't? You eat whatever they give you?
No, so I look for restaurants that are seed oil free.
Oh my God, you are my best friend.
There's a seed oil scout app.
Yeah, I know. In Miami, we don't have it. We have it's only in New York, I believe.
Well, it's in Miami now, so you can use it. It just came, so you can look at the app. It's all over the country now, so you can look and see where they are.
Finally, somebody cares.
Well, RFK, before RFK even became secretary, they took red dyes out. Wild. And now we're looking at other chemicals as being caustic, and we're taking those out as well. And so we're finally at a time where it's like, okay, our food matters, and it's essentially illegal in a lot of the world, so why are we giving it to our country? If we're supposed to be the best country, then why are we giving ourselves such horrible
Because
food?
they're making money out of everybody.
Of course.
In the restaurant, the same. Even top restaurants with the amazing chefs, they cook with the horrible oil. They don't care, because they care about what? About check.
Check, and it tastes good, makes more check, and
Yeah.
that's it. It's funny to kind of think about, the cash motivation behind this, because there certainly is. And I looked at a cosmetic product the other day, and they were giving out some stuff for Women's Day. A partner I was with got this box. I was like, let me just turn around. I never read women's chemicals. I couldn't pronounce half the stuff. And it was a hard thing back when I was in college, right? When I went to Cornell, which was a hard school, getting even a B in organic chemistry was a big deal. And I got an A-. I loved it. I could say the names. I didn't know what the heck was on the back of there. All I know is it was bad. It was like titanium hydroxide, aluminum, this, chemicals I've never heard. And it's just all chemicals. I didn't see anything natural in there. And even the ingredients that I'm assuming, say, with natural contents, they have some natural contents, but they have these caustic chemicals. And then, now we're finding out for some clothing lines, especially for women's clothing lines, in the genital regions, high concentrations of forever chemicals.
And it's funny, it's all over media, and I still see people wearing it. And I'm saying, did you hear? Yeah, but people, I don't think they're thinking, because nothing hurts, there is no symptoms, no emergency, and they don't take it maybe that serious.
Well, because it's a slow thing, right? It's like diabetes.
Yes.
You can have diabetes for years.
Years, and body will take this abuse for a long time.
And you won't know, really.
Yeah.
Unless you're super tuned in. Most people, it's called the silent killer. And so we have a little bit of this food, we think we're fine, but as we become more conscious, and if you eat healthy for like a year and then you go to eat something with seed oils, you'll feel it.
I feel it right away. I swear.
Yeah.
Yeah.
Your body knows it's junk.
Yes.
So I believe it's just as hard to find real food now as it was 200, 300, maybe 1,000 years ago. It's just as hard to find real foods. And I'm a physician going into the markets, turning the labels, looking at the egg shortages and the meat shortages, and it's hard for me. So I have resources and I have the intelligence for it, and it's still hard for me. And so I found it to be a real thing that people need to be educated on. And so I'm working on this course to help educate people on what they should be
It's
looking
amazing. It's amazing.
for. Yeah.
Do you feel you have a mission here in this life? What is your mission?
I think our mission is always what brings us the most joy and peace. So it's like follow the joy. And my joy has always been about spreading a message of like, it's possible to be okay. It's possible to live a good life. And, and maybe my way of creating these centers is just a way to, bring people into the fold and, let people see that there's multiple ways. Maybe take a course on breath work. There's a lot of good research. Maybe go do this psychedelic journey, if not here in the States, somewhere else. Or maybe you don't believe in that, and maybe stem cells is your way out. And maybe exosomes may help you. Maybe you getting your hair back is that way of you finding more confidence and feeling better. Or the joint pain, right? Like the things we attack at Springs are quality of life things, right? Like we want you to feel good internally and like want you to walk well. You can't enjoy that trip to Italy you've been waiting for if your knee is so bad and your hips so
Actually,
bad.
money doesn't matter if your health is not good. So I think number one, what we need to take care about ourselves, emotional and physical. And then when everything is in balance and everything is good, then you can think about money and other stuff.
Right. You talked to this one guy, he made $200 million, and this buddy from the organization was chatting. I was like, would you give all that money back to go be back in 20 again? He's like, in a heartbeat. Like, done. Take all and give it to you right now. And so it shows you a lot, like how we only get one body, and that's it. And it's like we're so hesitant to invest in our own bodies. But if you were going to the car dealer and you're buying a car and they're like, this is the only car you're going to have the rest of your life,
take care of it.
You would take really good care of it.
So let's go back to the topic about exosomes and stem cells.
So stem cells are these usually closer to the progenitor cell lines. Mesenchymal stem cells, which we like, are closer to the adult cell line, but they have this propensity, what we're seeing in the research, to help with all types of things. And again, we say it's inconclusive, and that is the common state, that it is inconclusive, but there's hundreds of studies now that I've seen showing positive results in everything from joint pain to skin condition to hair loss to multiple different modalities, wound healing. And so what's really interesting is these stem cells secrete these other factors. They're called EVs. Another word for them is exosomes, and this trophic factor, kind of like this soup. And what we're seeing is these signaling molecules, these exosomes are like signaling molecules. They're little bubbles, and in these bubbles contain mRNA, contain peptides, growth factors, proteins, and when you let those concentrate, and we use a dose of 250 billion around exosomes, and you apply it, for example, topically to the scalp, they can act as signaling things, and they can signal for stem cells in the hair to go, hair follicular stem cells. They've been shown in the research to have the potential to stimulate VEGF, which makes new blood vessels form in the scalp, and all other types of things. So it's really interesting what they could do.
And what you can do for beauty, for example?
Yeah, for beauty, it's mostly a topical kind of therapy. And just like, the Kardashians made the vampire facial popular, which was just microneedling to induce cytokine trauma and local trauma, and they put PRP over. It's the same thing, creating those...
I thought vampire, it's when you take the blood and then you separate
exactly.
And then you
just
put
PRP.
PRP.
And that's the vampire facial. So this is similar, except instead of using your own blood, you use stem cell-derived exosomes and put it over the face.
So you think it's going to be more effect doing this instead of taking your own plasma and putting it here?
Yeah, so the whole point of taking your plasma is that it has growth factors in it and maybe very small amounts of older stem cells.
Yeah.
Excuse me, like stem cells that are your age. Well, what if you can get a higher concentration of the most potent part of the stem cell, we think, which is an exosome, get that to be super high concentration, and just give that instead? Well, it would make much more sense. Like
maybe more expensive.
Yeah, a little
I think
bit.
this is cheaper to use your own material.
Oh, it's so cheaper,
what do you think about, like, for example, my mom said the other day, I saw on the TV, there is a guy, Don't Die.
Oh, Brian Johnson.
Yeah, he lent his plasma to his father, and the son gave to him. What do you think about that?
So this is based on an old mouse study. So there was a young mouse, an old mouse, and they took their circulatory system and tied it together. And the old mouse started to behave young again. And the hairs started to have color again. And so, well, what is this that's making this young mouse help this old mouse? And so for a while, there's been these exchanges. Brian Johnson has just made this public. A lot more people than Brian Johnson have done this. But really what I think was in this solution, what they were finding were younger stem cells, right? So look at it this way. You're a younger kid, you're 10 years old, and you get a really bad cut on your leg. That cut's going to heal really quickly.
Yes.
Now you're 90 years old, you get that bad cut in your leg, you may die. Right? It's not going to heal as quickly. Well, what's facilitating this? I believe stem cells are a big part of it, and I think these studies with the mouse one being an earlier study, now we have more evidence to suggest that it really may be these stem cells and exosomes that are promoting this kind of healing.
So it's out of the camera. So you recommend me to take, not to do, because I do this sometimes.
IV?
Yes, not IV. I take separate the plasma and put here. I did twice, and I need to do like a course.
Yes.
That's what she said. And then she's coming soon, and she said, let's try that I give to my mom. Do you think it's,
You're probably more effective you giving to your mom
than to take it for me.
So you giving your mom your PRP is more effective than her giving her own PRP. The same way that if you're getting PRP from an 8-year-old, which you shouldn't do, it'd be more effective than getting PRP from a 30-year-old. So it's just the same way that getting umbilical stem cells from an umbilical cord of a newborn baby, just the umbilical cord, no babies are hurt.
Yeah.
And so you're getting those, they're fresh cells. It's obviously going to be much, much more effective, in my opinion.
Yeah, interesting. So how much will be this type of procedure to make your face look beautiful?
It depends. It depends on how many you need and what the package is together. We always make sure to fit with anyone's budget. So you can even do like $100 a month, sometimes $200 a month, and we can get you on a program to do these facials.
So you do programs?
Yeah, we have programs, of course. We're a longevity partner, right? So the way we started, we had a lot of UFC, Bellator, WWE, NFL athletes coming to us, collegiate athletes, and we worked as like their partner. So they were always able to contact us, and there's like a program. And so our job is now to create that for our patients, to be your longevity partner. So now we're partnering with you to make sure that we can guide you each step of the way.
Okay, I could be face of your company. Let's start. Let's see the results in 2 years.
Yeah, you get younger and younger. You look 15.
Okay, I won. Okay, it's amazing. So what about hair transplant?
Well, I'm very near and dear to my heart, clearly. Being almost bald, we've done a lot of these. It's one of my favorite things to do, if not my favorite thing to do at Springs. There's a topical procedure for those who are not bald yet or like want to prevent it or kind of getting there, where you're like a Norwood 1 to 3, 4. And then if you're already shiny bald and you've been shiny bald for a while, there's a new treatment. So it used to be the strip procedure, that used to be the FUE, and now it's the micro FUE. And so what that is a suction device with a guard that prevents transection. So it avoids cutting the hair shaft in half or the follicle in half, so it survives better. And so it's a sucking motion from the back and sides of the head and then reimplanting it.
So even if you're bald, you can possibly have hair?
If you still have a donor area.
Oh, interesting.
That's why I say it's very important for patients, if you're going to do it the right way. Do the micro FUE with exosomes or stem cells together, because once you've had 2 or 3 hair transplants, you don't have a donor area left.
Yeah.
And a lot of the patients will come to us, I have to turn them away. They've had 3 hair transplants and they have no donor area, and it stinks, but I'm like, no, I wish we
So even stem cell not going to help?
It's not, you would need cloning at that point, because stem cells, I think, helps because if the follicle is still alive, the unit's alive, but just not producing a hair shaft, then you can stimulate, I think, the unit to make more hair shafts. But if it's been like 5, 10 years and you're shiny bald, well, not much is going to help you except a hair transplant. Even when you do a hair transplant, imagine taking healthy grass, great grass in a fertile soil, and putting it into a desert. There's not great blood supply, there's not into water, there's not great nutrients, and then you want it to live. Well, that's why some people are getting hair transplants and it's falling out, I think, is because the scalp is dehydrated, it's not getting enough nutrients, and whether it's genetic, whether it's hormonal, whether it's your lifestyle, whatever it may cause inflammation in the scalp that can shrink the blood vessels. And if you shrink them enough, great blood supply, well, just imagine, like, why would the hair that's healthy on the side be okay on the top now if there's not a great system to keep it that way? So it's about prepping the scalp, making sure it can be healthy before you do anything, and then going ahead and doing the micro FUE and making sure that you do it in a way where you're using an artist for the aesthetic appearance and then a physician for safety alongside the best machine. And we use the NeoGraft 2.0 from Venus Concept with our own custom micro shield on it to prevent the transection. When you look at this, you can Google it, it's very sensitive to the machine and technician. So anywhere from 50 to 75% at worst, grafts may not take if not done correctly. Whereas if you're using special machines and you have the right artist and technician, the rates can be well above 90%, and maybe even greater with stem cell and exosomes.
So you can use stem cells for beauty, for hair, for injuries, and also for be younger, right?
There's some suggestion for that. You know, we're still waiting on the research, but it may be the case that it improves something called your VO2 max. So if injected intravenously, it may have an effect on the way your lungs and heart you work with
like
oxygen.
Organs.
Yes. And there's some research to suggest that. I mean, the most famous cases with mesenchymal stem cells were from celebrities. You know, one person's dad who had heart failure, about 30% ejection fraction or less, I think, ended up living another 10 years after he was given 3 months to live. And, you know, there's a lot of cases like this. You know, we're still waiting for formal, you know, okay, you can go ahead and do this for these diseases. You know, I'm hopeful that this new administration will give the green light for that. Because I think the real benefit for stem cells is going to be for people post-stroke, cardiac disease, even to prevent it. And then for athletes, I think the reason why they've been going overseas and the reason why they come to us is because, like, if you get this intravenous therapy, you know, it may help your VO2 max and you perform better. And whether it's a placebo or whether it's truly real, the athletes believe that it's helping them to perform better.
Do you work with lots of famous athletes?
Yeah, we've worked with lots, some of them on our page, some that, because they're currently active, you know, want to stay under the radar.
So you cannot say the name?
Some I could say. I mean, the most recent one that we've done, he's making a nice comeback here. He's a great, I love him, Jorge Masvidal, really great guy. We did another one even more recent from the Super Bowl. I can't say him, I wish I could. Really cool dude, and we've done some Pro Bowlers as well. We've done an Olympian who's really high caliber. A lot of UFC guys, Bellator guys, and so those are our main.
But they come here because they have injuries.
They usually come, because they have like a rotator cuff tear.
Yeah.
You know, we had a really great jiu-jitsu guy, Rowan Jukau. He trained Douglas Lima, and he wanted to compete again. And, you know, and to win, obviously, he's a great black belt, maybe one of the greatest black belts ever. And he had a tear, and he couldn't move his arm from this level to this level. Well, he's a great wrestler. And so if he can't do that, he can't do his moves. So we gave him the injection for his rotator cuff tear. He listened to nothing we said, by the way. Holding pads for pros, still training. He went, did that competition, and won the medal. He won at a high level at black belt. And, you know, he's doing his wrestling moves, and so we had him come back, and we're like, there's no way. He just muscled through it or something. And my doctor at the time, Dr. Nieto, looked at the shoulder, and he's like, holy crap, dude, this stuff works. Like, the rotator cuff was not there. And we could see the ultrasound before, clear, looked like almost a full-length rotator cuff tear, like 50% tear. And we couldn't find it at all. And he was functioning better, which is the most important thing. He felt fine. And so I think there's a lot of success. Is it a panacea? Will it help or heal everything? The answer is no, but I think there's a lot of good applications for this potentially.
Yeah. So then why everybody goes to Turkey to do their hair transplant? Because it's cheaper?
Well, if it's $1,000 versus, you know, in the U.S., and we don't charge as much, but like Bosley can charge up to $35,000. You know, a lot of places will charge $30,000 plus. Well, you can do it for $1,900, $3,000. Of course, you'd go there. And I just posted recently this video from a bodybuilder who's like, they tried to pay me to go there, and like, I'm not going there because it makes people's hair fall out the way they do it in Turkey, and no one's hair lasts. And he just called them out on blast. And I think for sure there's maybe some good work they do. I'm not that familiar with Turkey, but I do know that we have patients that come from there who their hair has fallen out, and we have to go and correct it. And so while there may be some good places, there also may not be. Places, yeah.
Would you like to show me your beautiful office?
Come on, let's take a look.
If you had the chance to try stem cell therapy, what would you use it for? Recovery, beauty? Drop the comments below this video.
These are the rooms coming back here.
I think she's recording.
We have multiple kind of offices, as you can see, all different kind of tools and bells and whistles in here. Let's make sure we're not looking at any patients. So we have, it's a live office day today, so it's active, it's a Friday. We have the offices are a little filled today.
I see you have lots of offices. How many rooms?
There's about, I think, 40 different rooms
40
in total. And then this here, we get to meet our lovely nurse here and our medical director, Dr. Celine, coming in for the shot. What's up, guys? There we go. We got the whole crew coming out, the Springs crew. But come on, then we got this.
So what is this? Members lounge. What does it mean?
This is just the lounge area. Just
for the patients to hang.
Yeah, if a VIP comes, we have them come back here. It's like the NFL guy that we had. We just had him come back here and like wait, because we don't want him waiting in the waiting room.
Yeah.
Right? And so we had him come back here, come and hang out, and yeah, that was it.
That's nice. You have a terrace.
Yeah, a little terrace out there, and we got Lauren hanging outside. We got Audra hanging out there. The patients can come have their lunch out there if they're waiting for a procedure.
Do you personally do something for the patients, or you overseeing the business?
Sometimes I'll treat some patients, but overwhelmingly just trying to make sure that patients get the right thing done for them, and supervising a lot now.
Cool. When you was working at the emergency room, right? Yeah. How long you've been working there?
I was an attending physician. I was still a board-certified doctor in the ER. I worked in the ER for about 7 years.
7 years. It's very intense. What was the most difficult?
In the ER?
Yes.
Probably the most
part of the job.
The most difficult part was having to task switch, I think, between like really sick people that were dying or about to die, and then helping them and putting all your energy into them, and then someone who had to wait, 15 minutes, 20 minutes longer, even maybe a couple hours, and they're mad at you, like, what were you doing?
Yeah.
Well, sorry, I was in the other room. So that part of the job wasn't that great, but also, we would have to tell some bad news to people. I worked in a trauma center for a long time, and then I worked single coverage in a rural area, which means I was the only doc sometimes in the hospital. And so when something happened, I really had to give the news and be that person, that voice of advocate. You kind of take that stuff home with you. And I remember I had this one young guy came into, I was working at a trauma center at the time in Brooklyn, and I was leaving my shift, and this young man, really young guy, got shot. And it was just like one gunshot wound. And he looked at me so afraid. He's like, Doc, am I gonna die? I was like, oh, you'll be okay. We took care of him. He ended up passing away. And I was like, oh, fuck. So that was really hard. But also some really beautiful stories. I remember one, I'll try to not be emotional, because this story broke me for a long time. I was with this elderly couple. This guy was, I think, in his 80s. He was I don't know if I should say his name. I won't say his name. He's a prolific writer, wrote a lot about wars and would go to the wars and actually document stuff. And so he was in his mid-40s in Japan, and he saw this American girl. They went up and they fell in love, and they got married. So now fast forward to they come into my ER, and she's telling me all this stuff. And he was just writing up until like a day ago, and all of a sudden crashed. We had to put a tube in his throat, hook him up to all these things. All of his vitals are wrong. He's clearly dying. We took an x-ray of his lungs. We're like, how are you even alive? Like, he had some really bad stuff going on. And he was in the middle of writing another book. He just tanked. And so I'm telling his wife this, and she's telling me a story about how they met and how much she loved him and all the beautiful stories. And so we go finally into the room, and we're just taking him off of everything for comfort and letting his vitals come down. So what's happened is you'll see like the respiratory rate's down, the heart rate comes down, and eventually they pass. And so as he's passing, she puts her hand on his shoulder, and she's like, "Thank you, sweetie, for a beautiful life."
Oh.
It was just probably the most beautiful.
He heard that?
I have to imagine that he heard it, right? Like, we're still kind of semi-conscious in that realm, and I've met people who have been dead and come back and have some pretty cool stories.
Yeah.
But it was just like the close to a chapter. It's so beautiful.
Oh, yeah, it is.
It was so beautiful.
I don't want to cry.
And so you see stories like that, and it's like, so you see both ends of life. And I think for me, it's given me a great appreciation for like, okay, let's live a great quality of life. And let's live that quality of life now.
Yeah.
You never know.
To be thankful at the end.
Yeah.
That I did everything correctly. I was with the right person. I did everything what I could.
Imagine that. When it's all said and done, it's just like, thank you.
Yeah.
And I still think about it. It still gets me. It's still an emotional story.
Well, I heard a story actually from our friend that you was helping kids. You was dressing up as a Superman, just to
Spider-Man.
Spider-Man. Yeah.
So I used to. I got a beautiful chance to attend a bunch of Dr. Joe conferences, the community we met through. And when I was at one of these conferences, I met a gentleman by the name of Pierre, and we started going around doing these healings on people. And then when I'd go to these healings, and I'll explain, and when I'd go to the conferences and they would do these healings, and I'm a board certified doctor in there, and I'm meeting other board certified doctors. There was even a physicist in there, And when I say healing, it's everything you kind of would think it is. It's someone in the middle of the room, and it's like a circle around them. And you just put your hands out and you give love, right?
Yeah, and you send love.
You just send love.
Yeah.
That's it. And Dr. Joe teaches this. And so we started doing it in these conferences and even outside. And as a board certified doctor, like, how do you reconcile when something's there in one moment and it's not there the next moment?
Yeah.
It's very hard to conceptually recognize this. And I think one of the major stories that got to me was, I know what pain looks like, right? As an ER doctor, I know a lot about truth, especially New York City ER doctor. Like, you can see the BS. Sometimes people want to get pain meds from me or whatever. And I sit next to this Green Beret, or he's a military guy that used to jump out of helicopters. Couldn't really walk. And then he came to the conference with his wife because, you know, it was the last straw for him. He wanted the doctors to cut off his legs because he's like, I can't live like this anymore, and like, it's constant pain, and I can see it. And he had these like crutches that wrap around your arm to get up, and he was in real pain, and he couldn't move. This guy went under one of these things. Dude, zero kidding you, he's sprinting down the beach running. Ended the conference walking around. And if that's one story, that's fine. But I'm talking, there's cases of tumors that were there in the morning and they weren't there. And I have to reconcile this. And I know how this sounds. It sounds like, oh, Charles drank some Kool-Aid, they're giving out drugs. But after a while of seeing multiple people like this, how do you go back as a physician to regular life and say, oh, okay, I'm going to do this regular stuff again? So I didn't. I took 2 years off kind of following this thing around, and part of that was, you know,
Can you imagine if, for example, you go back to the hospital and you're saying, okay, now just meditate. You know, no pills, meditate. What people will gonna say? Doctor, give me the pill. Everybody wants a magic pill to take the pain away, to make it easier. But actually, we could make ourselves healthier.
Maybe we're the medicine.
We are the medicine.
Maybe, and I think that's what the whole conference is trying, that's what Dr. Joe is trying to teach you, and now the University of San Diego is proving it, is the research is coming out.
Finally, they allowed this to happen.
Finally, right.
You remember when the COVID was? The Joe Dispenza? He had some paperwork done. They did tests. I remember at this conference, we were wearing these wires. They would take blood work, and they did experiment. What the meditation can reduce?
They showed that when they had COVID, that the COVID wasn't getting into the cell.
Yeah, that the COVID was not getting into the cell.
Yeah. And then they just found, this is published, we can say it now, and this is not just, oh, this is some independent research from Dr. Joe and he's a woo-woo guy. This is the University of San Diego, Dr. Hamel Patel, a real practitioner in there, great human. He's a hard science researcher.
Yeah.
He comes into something skeptical to disprove it.
Yep.
And that's what I loved about watching this research.
Yeah.
Taking blood, doing the EEGs, like really doing a hard science-based research, you know, placebos, back and forth. And so now they found this thing called Serpina-5, and when it's introduced into cancers, it's kind of, you don't see them. The cancers, shouldn't say this, but maybe you don't see the cancer anymore.
Yeah.
And so it's really wild stuff. And I don't want to take away from what they're doing, but I became very engrossed in that community. I really enjoyed seeing this stuff. I enjoyed seeing the science. And so I would every once in a while, I'd just dress up as Spider-Man and try to do this for the kids and just give them love and be in the rooms with them and just, you know, the weirdest thing ever. You would sometimes see some stuff and, you know, it's just really cool. And I think there's a mystery to life, right? There's more than meets the eye. Like, I think if we told people 500 years ago, 1,000 years ago, you would talk to someone on the phone and they would be in China and you'd be in the United States and you would see their face and have a full conversation, they would say witchcraft or something like that.
Yeah.
And I think maybe the next big hurdle is not maybe a new drug or something, but it's realizing we have this power in us and that maybe there's something to belief and faith. Maybe there's something to this, you know, esoteric world that we've shunned for so long.
Yeah. Do you believe in past lives? Do you believe that
I believe the soul is infinite, and I believe we've had many experiences. I do, you know, I do, and like I've seen again enough people pass to where they pass and come back and they'll say stuff, and it's very similar, and it's really odd. And then I've also had my own experiences with just meditation that, you know, some would call transcendental, and I almost I can't prove it, but I know in my heart that the soul is eternal and that this is a part of the journey.
of experience. So you built already 5 offices. Which challenges you faced with growing your business so far?
That's a great question. So the main challenge with any business, I think, especially with mine, is making sure that the patient stays first and that we're always doing high quality care. And it's challenging to deal with centers across the country. So you have to get people that you trust and people that are really dedicated to excellence when it comes to treating patients well, being safe with them, managing expectations, making sure that we're saying the appropriate things to patients, and following regulations to the T in the best way that we can. And so we always try to keep that focus while making sure our patients get excellent care. And of course, the product has to be the best. So we have searched for a long time for the best labs, the best products, and I'm very confident that, okay, I think we have really head and shoulders above anything else I've ever seen. And then we, of course, make sure we get the best devices and the best board certified physicians. And so maintaining that system, it's a moving organism, if you will. It's alive, and it's really important to keep it flourishing so that the patients benefit from that kind of therapy.
And where is your lab located?
So we have labs across the country. There's one in Texas, Florida, and California. Main one is based out of California and Florida, and they do a ton of testing. They're publishing a ton of stuff as well.
So it's always evolving?
Always revolving, and it's also a CGMP approved facility, which means that even though the FDA doesn't really approve or like of most stem cell treatments, they will grant CGMP status, so just good manufacturing processes for the systems and practice of the lab. So you want to make sure those labs always have that certification.
What's money means for you?
Yeah, that's a great question. So I met this guy, Peter Evans, and when I was out in California. He lives, won't say where he lives, but I met him there and got introduced to him by a lot of close people, and Pierre was one of them, and did this breath work with him, and I trained with this guy for about, I would say, 6 months. And he's a notable character. His name is Peter Evans. He was an Olympic medalist, and he just disappeared for a while. And he was one of the guys who would go to the Playboy Mansion and just was gone. And he left to go to Egypt and Tibet, and he said he wanted to follow the footsteps of Jesus. I was like, I gotta meet this guy. He did this breath with me that was, a psychedelic experience.
Yeah, I've done this also.
Yeah, so you know. And we started learning his chants, and one is Om Mani Padme Om, Om Mani Padme Hum. Mani, 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 Mani. Money to me is an energy, and it's an energy of love. It's all love. And if you're saying Om Mani Padme, it's open into the jewel of my heart. You're talking about the heart. You're Mani, the jewel, Om Mani Padme. You're giving thanks and praise to the heart. And if you look at you want to get more esoteric, the chakra colors and green, and money is green, and the grass is green, and it's an energy. It's a really powerful energy, and it can do a lot of great things. And one of the biggest lies is that, if someone has a lot of money, they're a bad person. Well, maybe they're a good person. Maybe they do a lot of good, And so I'm very much of the school of thought that money is what you kind of create with your heart, and it's a whole belief system to how much we believe we're worthy to have. And once we feel worthy and we see it, money is just part of the equation.
How important community is for you?
Community is the biggest thing, especially now with AI ramping up. The only thing that AI will not be able to replace, will be unable to replace, is good community, is people coming together, like-minded people, or even people with differences who have a common goal, or just want to learn from each other and be around each other. And there's something special that happens. We were meant to be social. I don't care how much money you give someone, if you put them in isolation so you can't talk to anyone, or there's, wild. And so for me, it's all about that community of good people who want to grow together, elevate together, love together, and are just genuine. Wash the ego away and do your best to always, or at least I try to do my best to always grow and elevate.
And actually, I know you help a lot. You help other people, right?
Sometimes.
Let's talk about what changes you do in other people's lives.
So I really believe in this concept of Eastern acceptance along with Western modalities, right? I think there's a time and a place for everything. For sure, surgeons are great. Stem cells are great, and I think they help a ton of people. And there's a time and a place for that, but there's also a time and a place for faith, and there's also a time and a place for some of the practices of Eastern philosophy, and Dr. Joe has always been a big part of my beliefs, and I've followed the poor guy around the country, like 9 of his conferences. It was like, who is this guy at my conference every time? And it really made me see that maybe, his book is You're the Placebo, but maybe we are the healer inside of us, and maybe there's an energy and a power within us that can help us heal, whether it's yoga, breath work, there's many routes up the mountain, and I think we can create our own healing, and there's so many case studies of this happening. And I liked Dr. Joe particularly because he had this guy, Dr. Hamel Patel, who was involved with research and a really hard science researcher from the University of San Diego. And you can't refute the science backing up this woo-woo, I call it. And so I love having centers where we can have people come in and experience both. And it's my ultimate goal to have these longevity centers throughout the country where maybe you come in and just do a breathwork or yoga session. Maybe it's a stem cell session. Maybe it's a meditative session. But a true holistic, skin to cell, mind, body experience.
I know that you are donating lots of money to help other people.
I have, I've given some to different organizations for sure that I believe that are doing great work. I always have a big, heart for people with PTSD, women and children, of domestic violence, and also helping to fund whatever research that I can when it comes to evaluating the woo-woo medicine, the science of the woo-woo to help people get better and to improve their lives. And anytime I get a chance to do that when I can, I always make sure to jump in.
What are the 3 rules in life you follow?
So I really only have 3 rules to make it simple for myself, right? So number 1 is just be honest, right? So when I do things, always in the most honest way that I can. Number 2 is be kind, right? And I think when you're kind in life, kindness just finds a way to come back to you. And the last thing is do whatever the heck you want, right? So I feel like if I'm just honest to everyone and kind, whatever else is fine. Like live life free. This is the only time we get to live this journey right now, so might as well be free.
Amazing. You grew up, let's talk about your life. Your life was not easy at the beginning, right?
No.
You had ups and downs.
Yep.
Where you grew up?
So I was born in New York in Long Island, Winthrop Hospital, and was actually born doing quite well. My dad had a great job at the time, my mom, and then early on, like 5 through 7, there was trouble and my dad left, and we went through a time where we were essentially on food stamps. I had a period during this time where I was sleeping in an abandoned Foot Locker for a little bit, and it was just a rough change from remembering all the good stuff when you were younger, which I did, to that point. And so I dropped out of high school in the 9th grade, right? And I got a job in construction. I actually started work when I was 13, but I still went to school and then got a job in construction. And my mom came to me one day when I was working on the roof, and I'm doing this, it's 90-degree weather, and I feel great, right? Because at the time, I'm still in my teens, and she's like, what are you gonna feel like doing this when you're in your 40s and 50s? And I was like, oh, what else am I gonna do? She's like, well, be a radiology tech. And I was like re-inspired for medicine. I was like, how much do they make? And she's like, well, 60, 80,000 a year. I was like, well, that's a lot of money, I thought. And I was like, okay, well, I'm in. I remember getting off the roof and I was like, maybe I'm not gonna go back, I'm gonna go to college. And I went there.
But you dropped the school, high school.
I dropped out of high school, and so I wanted to go to college, and I got very blessed. There was a lady who was leaving her place, which was about 45 minutes away, to come to my library 3 times a week and teach me to get my GED. So she drove to me and really helped me to get this.
Where is she now?
I don't know. I should reach out to her again because she was a life changer.
We need to remember those people who help us.
She was probably one of the biggest figures in my life, like an angel, right? Who drives almost an hour away 3 times a week or so to help train a kid. And so she did. And she didn't have to do that. And I remember getting my GED, and then I was so silly at the time. I hadn't been in school in a while. I remember going to Stony Brook and Nassau Community College, and they asked me, are you an undergraduate or a graduate student? I was like, well, I graduated high school, so I guess I'm a graduate student. Well, clearly that's for PhDs or MDs, and so I wasn't a graduate student, and they laughed at me. So one of the professors at the college I was at the time didn't like me. He heard that response, and he gave me all these hard classes. One was anatomy and physiology. So my first test as a college student ever was all the bones in the body and all the like holes in the skull. So every blood vessel and nerve that comes out of the skull had a toothpick in it. And you had to shorthand write the test. And I studied and I did it. I took it up to the guy and he marks in front of you. And I got every answer right, because I misspelled one. And he thought I was cheating. Like, made me do it all over again. And so finally we take a second test. This is now down the road. He's watching me. And I got a perfect score on a test. And so he comes up to me, he's like, listen, if you're really not freaking cheating, you need to do something else. He used the F word, like, really not been cheating, you need to do something else. And I wasn't, and I was like, well, what else am I gonna do? And I got re-inspired to kind of become a doc. And I remembered the story from when I was younger. I had asthma, and I had gotten pneumonia when I was young, must have been 8 years old, but I was a quiet kid. I never, ever complained. And so my mom's leaving for work, and she noticed my color was changing. So she drove me to the ER. And she was so scared, she just told me to get out. And I got out, but I couldn't make it into the ER, and I kind of collapsed. The next thing I remember was these doctors surrounding me and me starting to feel better. And I just felt like this nostalgia for these physicians and for this white coat, and I just remembered that, and I was like, I'm gonna be a doctor. And I was like, I'm gonna do this. And so was really blessed to do a lot of prep programs. I actually did an experiment where we were able to stop a cancer cell from growing, which is pretty cool. Then I remember walking through the lab. This is a very popular scientist. I believe he was a Nobel laureate. We're walking through the lab and we see this tissue culture hood, which is like a glass pane with these hand things like in the movies that come out. And he's flushing back and forth this thing. And I'm like, what is that? And he's like, it's an umbilical cord. And I'm like, oh, what are you doing with that? Why do you have an umbilical cord? Like, for stem cells. And I'm asking again, I was like, what are stem cells? And he stops. He's walking a group of us. He looks at me and says, Charles, that's the future of medicine. And I ran with that all the way till now, the rest of my career. And so I remember doing these prep programs. I was blessed to get a scholarship to go to Cornell. I did a bunch of my studies there. Ended up doing my residency in ER at New York Presbyterian as a Cornell affiliate hospital. And all throughout it, I wanted stem cells. And my first day out of residency, I already had my stem cell thing set up. And now we've been treating dozens and dozens of athletes, some of the top athletes in the world, thousands of patients across the country. And the goal is to be people's longevity partner and to really look for ways that can help heal patients. Like whatever that modality is, I think people deserve to have that kind of access towards it. And people deserve to get access to stuff that only celebrities or the ultra wealthy could get. And that's the goal, is to bring that to them.
Amazing. Let's talk about your love life.
Oh.
You're gonna be a dad soon. That's exciting.
I'm going to be a dad any day now. 38 weeks. This
How it's changing your life?
It's weird. Like I do feel
but now
happy.
it didn't change yet.
No, I feel happier. Every time I think about it, I think about the baby. And I know sometimes guys are scared. And of course, there's some fears involved around it. Like, am I going to be a good dad? Am I going to take care of him well? But it's been a lot of joy and a lot of
Excitement.
A lot of it. I mean, and I'm so blessed. And now I'm just like, why did I not want to have kids before? I want to have plenty of kids now. Now I want to have a ton of kids.
11, I heard 11, right? Magic number.
That's it. You got to keep up with Elon, or what is it?
What is the secret to find the right person to have a kids with?
I think you always want to have love in the household. So love has to be there. It's the foundation for everything. And a love is based on a ton of things, right? Mutual respect, interest, and then I do believe in the whole soulmate concept, which I know is esoteric, but I've tried to define it, right? As a scientist, what is my criteria for a soulmate? And so for me, it's someone that you can deeply have a physical, passionate attraction to, whilst at the same time really enjoying the intellectual component. The conversations are fully stimulating. You're engaged, right? And then the other part is this, I call it spiritual thing, where you're sitting next to them, you don't even need to talk. It's just you enjoy their company. And underlying this is a profound respect. Like you really respect who that person is, you respect their journey. And for me, that just makes the best relationship in the world. Like you can live a full life with that person. It makes traveling better. It makes a kiss better. It makes eating lunch better. It makes everything better. And love, whether we want to admit it to ourselves or not, is the foundation of life. No matter what race or culture or gender you're from, everyone feels love in their heart. There's love, and it's the driving force of life. Ooh,
Do you like to read?
I really enjoy to read.
Really? You're reading every day?
Yeah, pretty much every.
Wow, that's
every day.
amazing. It's a great habit.
It's a great habit. I think there's a different book for every season. And this is going to sound incredibly cliche, but as I get older and I grow a little bit more wise, and I think you can find this out in many books. I'm going to give you 2 books. You know, people are going to think the first one is cliche, but I've learned so much from the Bible. I've learned so much. It is, for me, the ultimate book of wisdom and living life. And, you know, if you really just read through it, there's more than just meets the eye. It's more than just a story. There's stories within the stories and lessons within the lessons. And maybe there's more there than just the words that you're seeing. And for me, very impactful. Aside from that, I'm a big Neville Goddard fan. I love all of his books. The Power of Awareness has to be one of my favorite books. If you haven't read Power of Awareness,
I didn't.
It's a life changer.
Okay.
I think it's what all these people like Abraham Hicks, Dr. Joe Dispenza, all these people have really put together a foundation based on Neville Goddard's work. And I highly recommend it. The reason why I like it is because it shows that we are an energy, and if we truly can see something in our mind's eye and feel it done and feel the faith, which by the way, the Bible says, right? You know, it tells you exactly how to get stuff. It tells you, if you want to know how to get stuff, it says, ask for it and be thankful. And it's so weird, like, why if I ask for it, I'd be thankful? Like, I haven't gotten it yet. Well, it's telling you, it's like, you should know that you are deserving of it, and because you asked for it, it's already yours, so just be thankful. And it's our lack of faith. You know, it's the faith the size of a mustard seed, I think it asks for it. It's our lack of faith that prevents us from the things we want. So if we just ask for it, you know, I would love this and this, and then you see it in your mind's eye. You can see it when you close your eyes and you feel like it's already happened. Of course you would be thankful. Like if you saw this situation, you saw the love of your life, you felt this love, or you felt this, even a Ferrari can be symbolic. People think, oh, Ferrari's Ferrari, but if the Ferrari to you is something that's a barrier, and you have to overcome beliefs of doubt about yourself. You have to overcome all these limiting beliefs of your self-worth. And you do that, well, it is just a car for some, but to you it's a symbol of all the things you had to do to get there. And you'll hear this a lot. It's never about what you got at the end. It's about how you got there and all the things we overcome to get there. And so I'm a big believer in that. So ask and then just be thankful, because you already saw it happen, so it's already done.
What do you think possibilities for the future for people who is doing meditation, healing?
I think we're going to see a change, right? Where we saw, you know, cleaning water was a big thing. You know, taking antibiotics was a big thing. You know, living to 35 was considered old at one point. And now we're like, well, what's the next big thing? And we talked about if you showed someone an iPhone looking at someone in China when you're in America, they would think it was woo-woo magic. And I think the next magic that we're going to see is learning that we have the power within to create, we have the power within to heal, and maybe we've always had this. And I think that is the next tipping point, the next piece of knowledge for all of us to be aware of.
Thank you so much. Thank you so much for your time. You're an amazing person, and I'm super happy we're friends.
Well, I'm happy we're friends too. Let's do it.
Wow, what a conversation. Don't forget to like this video, subscribe to my YouTube channel, follow me on my Instagram account, which is realtor.katya, so you can see more of my work, my lifestyle, and please let me know who would you like to see as a guest in my next video.